I'm Luke Story. For the past 22 years, I've been relentlessly committed to my deepest passion, designing the ultimate lifestyle based on the most powerful principles of spirituality, health, psychology, and personal development. The Lifestylist Podcast is a show dedicated to sharing my discoveries and the experts behind them with you. Dr. Dean Howell, welcome to the show.
Thanks, Luke.
It's great to see you, man.
It's good to see you. It's been about 4 weeks.
Yeah, it has. Every time I see you, which has been, I guess, this would be the 5th time, if I'm not mistaken, we have such fantastic conversations, and you're such a wealth of knowledge and life experience.
And you too.
Well, thank you. I guess it takes two to tango. But whenever I have conversations like that out in life, I'm always like, God, I wish I was recording this. So now we actually get to record it.
That's right.
So I'm really excited. And thanks for coming out to Austin, the new home. One of my fears when I moved here was that I got kind of spoiled living in LA, doing all my interviews in person for the most part. And I thought, man, if I get out to Austin, if I have to start doing them on Zoom, I'm going to be bummed. But I've been very fortunate. Many people have been passing through, or they make an effort to come here. So thank you for doing so. Flying is probably my least favorite thing in the human experience. So the fact that you did that to be here means a lot.
Well, you're welcome.
Yeah. How did you first discover NCR, or Neurocranial Restructuring, this treatment that we did some weeks ago in LA? How did that first come to be?
Well, I mean, I'm a naturopathic doctor by training. So I've been in medicine since 1982. And one of the things I had happened to me a lot when I was a kid was head injuries, especially nose injuries. And by the time I was in medical school, I didn't realize at first how chronic my sinus and breathing problems really were. And I discovered a technique called bilateral nasal specific, which went back to the 1930s. And there was one guy left who was still doing that therapy in 1979 and 80. He died in 1988. But in the interim, I studied with him for about 3 years and learned his techniques, and they weren't satisfactory enough. They were great. I helped a lot of people, helped myself a lot, but I couldn't get the real lasting results, and I couldn't get people's spines and things to get better, and the similar to chiropractic type techniques that I'd been taught in naturopathic medical school, they just didn't work. So I kept altering things, and I realized eventually that after I did these other treatments and people said they were temporarily out of pain, when I did that, they were less stable than they had been before. And when they came back in pain and with limited mobility, if I pushed them around in the gravity field, they were more stable. So I said, not only do I want them more symmetrical, which is what we always tried to do, massage, manipulation, whatever, we also had to make them more stable. So I started altering the collection of treatments that I would use, and I started realizing how important staging was with people, and developed the technique that I call neurocranial restructuring, and that was about, at the end of each treatment, making sure that the person was more symmetrical and more stable. Then the work would accumulate. That was wonderful. Well, that was good. And then what we've had to do since then is to keep changing it, because we were still not getting all of the energetic chakras, and the energetics of the body just weren't balancing out right, and we were still having biochemical problems. As for myself, I mean, I ballooned up to way over 400 pounds at one point.
Wow.
When my second wife died of cancer and all the depression and all of that. And I was sleepwalking and eating in my sleep. It was really weird. And it was, I realized that it wasn't me and it wasn't my emotions. I felt like I was being controlled by something else. And I decided it had to be in my gut. I was feeding it all the time. I'd wake up at 3 a.m. I'd walk through the house in the dark, around the furniture and around the chairs and the piles of junk and whatever, and miss it all. I couldn't do it. I could barely do it in the light, but I could do it in the dark perfectly and get all the way to the refrigerator. I'd be eating leftovers and I'd wake up from the bright lights. I tried to figure out, who's running that job? Is that me? It's not my emotional thing. I was just waking up because my eyes hurt. So it was parasites. And I had them huge. I started changing those things. So we start with the structural work. Then we started having to do get rid of the parasites, the yeast, the fungus, the heavy metals.
Wow, what a journey.
And then everyone starts changing. You've been pursuing the same kinds of things, right? Haven't we all?
Yeah.
We're always trying to fix all these different things. You got to do them all at the same time.
Right.
That's the trick. How do you do them all at the same time?
Right. So I just spent 4 days in 1 week with you in LA. And because I discovered you through one of the listeners back in the day, I have a bookmarks folder that just says I think back pain or something, and anytime someone recommends something, I throw it in there, and then eventually I get around to most of them. And so that's why I came to see you. But the treatments that you do are unlike anything else I've ever experienced in so many ways. One of them, obviously, being the bit where the balloons go in your nose. Mm-hmm. But then there was all of this energy work that both you and your partner, Rebecca, did, which was also phenomenal and very interesting. But I'd like to start with the balloon part, because I was on the table when this was administered, so I didn't really get to see what was happening or how that works. But it's unlike any human sensation I've ever experienced. It's very strange, and not entirely comfortable, yet at the same time, it's kind of like when you crack your knuckles or something, you're just like, oh God, that felt good. Or you get a good adjustment of any kind in body work. It was just so immediately relieving. But I'm just curious about that piece.
So back in the days, like 100 years ago, when people started trying to figure out how to move skull bones, we don't know who did it, but somebody realized that similar to a finger going up through the nose and going deep into the nose to move the deep bones inside there. So there's a bone called the sphenoid bone, and the sphenoid bone is part of the back of your eye sockets, the back of your nose. It makes these wings on the sides of your temples, and it has 2 little prongs that go down into the roof of your mouth. And people in the early 1920s, they called it finger technique. They would take their finger and drive it all the way into the top of the throat. It sounds awful, and I've never experienced it. I don't plan to, but when they did that, sometimes the people would faint from the pain, but they were getting permanent cures on sinus problems and some kinds of headaches. And so we don't know who. Someone realized a balloon could be the same shape. They started inserting the balloon uninflated and then inflating it, and it would push its way through. And at first, they thought it was just a way of pushing the bones into a better position. Well, as the years accumulated, they started realizing that when they got those joints to open, that the connective tissue that was inside the bones and outside of the brain, the various fascias, the meninges, and so forth, that those connective tissues develop tension like a spring would when you compress it. So when you'd open the joints, that compression, that tensile strength is available so that the bones will actually start shifting. And if you release the right pattern, it will shift backwards towards more symmetry. And if you're doing that, you're actually relieving the physical effects of traumas. Because that's what most of us get messed up by. We get our teeth pulled, we fall down, and hit our face, that kind of thing. Mm-hmm. As well as nutritional things. So like the Weston Price work is all about how, bad diet over generations makes us have less mid-face development too.
Right. So what are the mechanics of you, as you did with me, putting the balloon in there? Like what pushes the balloon in? How do you inflate it? And how do you know how much to inflate it?
Well, it's really quite easy. If you go into your nostril with your finger, it'll feel like you hit a little wall. And really, you're hitting 3 small bones, and you're hitting them edge on. So if you have 3 bones in a larger space, we have 4 passages that we can enter with a small balloon. But if we go to the backside where it enters the throat, like the way air goes when you breathe, only the lower 3 passageways lead into the throat. So we go here, here, and here of these 3 bones, and then into the throat. So we slide it in uninflated with a lot of lubricant if we need to, and then a small toothpick to insert it. Then once we have it in place, the way that we position our hands around your face is so that when we inflate the balloon, that it doesn't just pop right out of your nose. We have to block it so that the line of least resistance, the path of least resistance, leads into the throat. And when it does that, it pushes everything outward because it's bigger than the space. And when it opens the joint, then that connective tissue spring that's secretly hidden inside can go into action, and then the bones start to shift. So the tricky part is the choice of where to apply the force. That has to be calculated out to be the way that will improve symmetry. The old work was always performed in the same pattern, and they would just every day go through every possible passageway once, twice, or 3 times. So in that way, they never changed the symmetry, and they didn't get as much improvement. And they would put everyone, literally everyone, into shock. Every day, we treated every patient for shock. It was just how severe the shock would be that day. But it always, and I did hundreds of thousands of those treatments. I've seen lots of shock, but it's not necessary, you see.
And what inflates the balloon?
What inflates the balloon is a small bulb. I like to use blood pressure cuff bulbs. I use specific brands. Most of them won't hold up, but it's an economy kind of move. There are people that have made electric compressor systems, and I've always liked analog better.
Yeah.
So the other approach is too digital for me, so I have never adopted it.
Right. Yeah. It's difficult to describe the sensation of that particular part of the procedure.
It's very quick. It only takes 1 to 2 seconds.
Yeah. It's. I think you described it as something about when you get water up your nose, or
right. It's a lot like jumping in a swimming pool and getting water in your nose.
Yeah. It is. It's a little bit like, and I'm overstating this, but it has a little bit of that waterboarding kind of sensation where it's jarring because you're just not used to anything being up there, especially something that's bigger than the passageway, right?
Right. And additionally, you also know that you're having to allow yourself to be in a situation where you're going to change. I think that gives everybody the willies.
Yeah, we don't like to change.
Well, it's like jumping into cold water when you're standing on the dock. That's an instantaneous change, and you can't go back.
Yeah.
Right?
Yeah.
And so some people can do it, and other people, it just drives them crazy, and they can't. Well, sort of the same way for what I do.
Yeah. And as jarring as it is, even though it's quite brief, it also just gives you this incredible sense of relief at the same time. I remember getting off the table and just instantly feeling incredible. It's just, I don't know why or what's different. I didn't know that I didn't feel incredible, but it's just like
immediate flush of cerebrospinal fluid.
Oh.
Suddenly, it's like you get juice.
Right. Yeah.
Everything. You get perfect cerebrospinal fluid flow. Suddenly, all of your brain is working the way it does, the way it's designed, for at least a few minutes.
Right.
And the more treatments that we accumulate, because the results, if this is done properly, accumulate, the more we accumulate those results, the more optimally your skull will work all the time. And for mechanical, it's essential. And this and orthodontia combined properly is crucial for most people because they've had extractions, you see.
Right.
Yeah.
And what is it with the extracted teeth that's problematic?
It causes the face to collapse. So it pinches the nervous system, and it changes the way it balances. Your head balances on top of your neck. And based on the way it balances, our brain changes the position of our vertebrae and pelvis bones. That's what changes the ligamentous and tendon structures, is our body's trying to figure out how to best stabilize the head. And your body will choose the one that stabilizes it the best, even if it hurts, or even if it causes nerve problems, pain, lack of mobility. That's okay. All you have to do to know that that's true is to have someone snap your back into place, and you feel better for about, an hour or 2, and it starts going back. It's because your body would rather be stable.
Right,
people that do the same thing with their lives, right? I've had people that were 45 say that they tell me how much they hated their jobs. They just didn't want to be there. So I finally said, you can change jobs. Oh, but in 20 years, I'm getting such a retirement package. That stability. It's worth it.
Right. Right.
Same with the way you run your body.
So if one did, for whatever reason, have to get a tooth extracted, and for whatever reason they didn't have this modality available to them, what could one do? Would you recommend getting, a biocompatible implant, which incidentally I did with one of my missing teeth? Do you want to replace it, or are there any other interventions? And does it really matter if your face collapses because you're missing a tooth? From what I'm guessing, you're kind of creating a structural cascade of misalignment because of that.
Yes. Yeah. And of course, it is exactly that. So I would rather have you put in an implant than let it all collapse. That's
Got it.
for certain. There's rumors that there's ways to grow new teeth.
I'm waiting for that.
But I don't know anybody that's doing it successfully.
I'm waiting, man. The magic stem cell in the jaw. I swear, if I don't really have regrets in life, and I've done some extremely stupid shit. Sometimes out of ignorance and sometimes out of stubbornness and ignorance. But there's one thing I do regret, and that is not taking care of my teeth. When I was younger, I was a madman running around Hollywood with reckless abandon. And I used to open beer bottles with my teeth, and I was like, whatever. And I remember my grandma going, take care of your teeth. You only get one set, after you get the second set. And I didn't listen. And now it's, my teeth are mostly porcelain at this point. There's not a lot of tooth left there.
I'm looking forward to the concept, at least, of growing new teeth.
I love it. Let's do it. But
it is quite important. And so if you have extractions, you need to do something to try to keep your bite integrity. And if you've already had it happen in the past, that's why we often suggest that people get into adult orthodontia to re-expand them, because it's only when their head is its proper dimensions that it balances correctly on top of your neck, and that's when your neck curves and spine curves can all normalize. So you can't go in and manipulate someone's neck curve right and have it stay if their skull is imbalanced. Their vertebrae have to compensate, otherwise the whole thing tips over. So you have to keep modifying those things. So unless you can get a perfectly symmetrical skull, and orthodontia could be part of that with most heads, and along with my work, and you accumulate those benefits, that's when the spine and the pelvis and the shoulders and everything will start evening out. And you can't stay there if you get them all fixed surgically if your skull's crooked.
Right.
Because you're bound to wear out your technology.
That's so interesting. I think we think of our human bodies in a mechanistic, compartmentalized way quite often. So I would never make the correlation that if I had to have a tooth pulled, that eventually it's going to make my toes splay outward or whatever. It's
right.
Like we just think, well, if one part breaks, you fix that part, but we don't often think how we're so interrelated. That's so interesting.
Yeah, the integration is so powerful. Multidimensional.
And why is it that after just 4 days with you, that my nose is completely straight now when it was crooked before that? You look at it, does it look straight to you?
Well, it's like 95% anyway. Yeah.
And
Good.
I could have sworn, because
it was off to the side.
it was, right?
Oh, for sure.
Because when I was a kid or in my teens, it got quite crooked. I think I probably, to be honest, melted it away with cocaine.
Maybe.
And then wasn't a lot left. I think I melted it, honestly. That's the only explanation. And then I had a deviated septum from said melting. And when they went to look at doing the surgery for that, they said, hey, your nose is crooked? And I said, yeah, no shit, Sherlock. I got a mirror. And they said, well, when we go in and fix the deviated septum, we can make your nose straight. I didn't understand what a traumatic experience that was going to be. They made it sound like kind of like plastic surgery light. It wasn't like a big deal. And my insurance paid for most of it. But it was extremely painful. But at least when I came out, I was like, oh, no shit, my nose is straight now. And so I went and I could breathe better and all that. But over time, it did start to creep back over. And I was looking in the mirror today, actually, on my way to talk to you. And I was like, what? It's totally straight. And that's the only thing I've done. I didn't go get a nose job or anything. So,
well, see, when we open the joints in that area, because we're inflating the whole area with the small balloon. So when those joints open, the connective tissue that was laid down originally in your straight nose that got distorted when you had your injuries developed tension in the tissue. So then when I opened the joint by inflating with the balloon, Now the connective tissue says, oh, now we can move again. And it shifts back to where it used to be because now the tension's gone. And that's why your face feels better, is because it literally has less tension. In your nervous system, as we accumulate these treatments, it has less mechanical tension. So when people think of tension as being only emotional, that's not true. A whole lot of the tension that we experience is mechanical. And that's why you want these releasing techniques. That's why people like to do the hypertrophic breathing, the three and all that. It's because temporarily they release the tension. But if you can also do it in a mechanical way that is accumulative, then you can get long-lasting results instead of having to repeat the experience. But you can do it with psychotropics. You can do it with deep breathing. You can do it with various narcotics. But if afterwards you return to where you were, then your only benefits are the accumulated experience. You've got to somehow get your structure to be stable when it's in those new places. And if you use a substance and your structure temporarily opens up and it changes, figure out how to stabilize it when you're in that state, and you've done something cool. Now at one time, this would have been, 35 years ago, I was working with this holotrophic breathing guy, and that's what we were going to do. We were going to have them get all the training for their holotrophic breathing, and then we were going to do NCR during the breathing ceremonies to see if we could stabilize them and that they could retain it better.
Right. Because you get someone into that malleable, more, half in the quantum, half in the world of particle kind of thing. A
fun idea. Anyhow, so the idea that you have to take in that is that your structure does make a big difference in how your brain operates, your biochemistry, and your structure, because that's how the cerebrospinal fluid flow patterns are determined, therefore your whole brain activity levels. So if you're chronically depressed, if you're learning disability, if you're hyperactive, we need to change your mechanical structure. Make it all focus and center again, see?
That's so interesting. So the structure works with the biochemistry because of the spinal fluid. Are not your neurotransmitters carted along by your spinal fluid?
Absolutely. They're delivered.
Okay.
Right. That's what it's for.
So this explains the elevated mood after one of these strange kind of experiences of a treatment.
Right. And it's a mechanical basis, so that makes it safer than many of the chemical alternatives, which work.
Right. Right. And then that would explain why, just doing some research on you before this interview and before getting treatment, that you've had a lot of success with brain function in people that have cognitive issues and TBIs and things like this, right?
Yes, because when they have those various kinds of head injuries, their structures shift. And if their structure shifts, then their brain works differently. So when a person has a stroke or a traumatic brain injury of some sort, some of their brain is going to be damaged. That's especially with a stroke. It's by definition, and also with a concussion, that there's broken blood vessels. So afterwards, what we do now is ascribe all the changes to brain injury. However, the same incident also shifts the structure. So all you have to do is look at pictures of people, or certainly x-rays, and look at how the bones are in different places. If they're in different places, now the hydraulic function of the brain has been changed. So if we go in and start restoring bone position, sometimes 90% or more of the TBI and stroke symptoms will reverse, because it was more the displacement of the bones that made their symptoms like that. It wasn't really that bad a brain injury sometimes.
Wow, so interesting. I want to understand the anatomy here. So your brain is essentially this big piece of fatty tissue that's in your skull, and then there's fluid around the brain to allow it to move inside of the skull?
That's what they thought it was only for originally. That was 50 or 60 years ago. Up to that point, they said that the brain floated in fluid that was there to be a shock absorber for it so that it wouldn't get bruised. It turned out that wasn't the case. It didn't even protect it that way.
Really?
It didn't work that well.
See, that's what I thought it was. And so I fell for the meme.
And then they found out that it was full of neurotransmitters, so that you can affect distant nerves. It's like sending mail instead of shouting across the street. If nerves are right next to each other, they just open the door and there's the guy next door. bang.
Right.
They stimulate each other. But what if that one is down that way? It's way down there. Well, now we send it through the cerebrospinal fluid, and it's going to go from your head, it'll go all the way down to your tailbone.
Wow.
Because the strings go down that far, all the way onto your coccyx. And that's why we do a lot of coccygeal work along with cranial work. It's because those are the two mechanical ends of the nervous system. And then there's all that fluid flow dynamics, which flows a lot all the way down as far as your navel and up through your spinal cord and then around through the ventricles of your brain and into the brain tissues. So you can send like email, you can send something from your brain and it trickles down and then it hits it in another part of the body. So when you have blockages, that's when it messes things up. So if you've ever seen people that they call it hydrocephalus, and that means that they have water in the brain, but it really means that their cerebrospinal fluid is blocked and their head gets bigger and bigger.
Oh, wow.
Yeah. Did you ever see that scary movie Elephant Man?
Yeah. Yeah.
Okay. Or that one with Cher and anyhow.
Yeah.
So those were people that had problems with their cerebrospinal fluid. That's what made their heads so big.
Wow.
Yeah.
What a trip. Okay. What about PTSD?
PTSD also affects people's structure. So we find that it's a crucial thing if we want to remove the effects of PTSD is to restore the structure. Because when the people have those PTSD experiences, something horrible that makes them go, tighten up. And when they tighten up, their structures shift. And a lot of times, well, with soldiers especially, and with people that have been involved with crimes, there's also physical injuries on top of it. So all of that locks them into a place where their nervous system just does not work the way it should. And counseling has been proven to not work. The only thing that statistically has been working some is eye movement desensitization and reprocessing, EMDR. Mm-hmm. And that's where you have to relive the experience and then do certain eye movements at the same time. And it, for a few years at least, attenuates those reactions. So we find a much more results by mechanically releasing the skull, of course. Wow. It's way more effective.
Yeah, I did a few sessions of EMDR. I do actually have one friend that found it to be quite effective for PTSD. I did it, and I don't know. Maybe I don't know if I didn't stick with it long enough, but I had no discernible effect from it. So I just kind of gave up on it and found other ways, and I've had a lot of success in healing PTSD in other ways, but I find it interesting from the structural perspective because it's not intuitive. I would never think of that. Like, hey, maybe my skull's crooked. That's why, I freak out if I hear a loud noise or whatever the case is. It's really interesting.
Well, in 2010, I did a study with the Marine Corps in Camp Pendleton. Or actually, guys from Camp Pendleton that came to see me at an office I had in Carlsbad, California in 2010. And I worked with 6 guys, and I was going to work with them for 6 4-day series each, 1 series a month for 6 months. And I was working with them, and after 4 months, on the way back to the base, they voted that they were doing so well that they went to the base commander and said, we're doing so well, we want to give other people our remaining treatments.
Really?
Because we're like better than before we went in the Marine Corps. We have none of the problems. And they were having insomnia and headaches and, the classic stuff. There's the checklist, right? There's 6 things, and 4 of them, any 4 of them, you have PTSD. Mm-hmm. Anyhow, all of their symptoms were gone. And his response was kind of weird. He says, it's the stupidest thing I've ever heard of. I'm canceling the project.
Oh, man.
And we were canceled, and I couldn't even have my records.
Really?
Yeah.
Wow, that sucks.
So I have no proof.
So you don't even have case studies to go share?
Yeah, no proof.
From listening to your other interviews, it sounds like you have had kind of an interesting time. As an innovator, you've had an interesting time in the legal world in that sense. Like I remember in one of your interviews talking about having difficulties in trademarking the treatment you had developed, or other people taking it and running with it and doing it in a different way and calling it what you do and things like that. What's it been like to, be the creator or innovator of a modality? And I don't know what kind of success you were looking for. It seems like you're doing great. You can barely book you. You're in high demand and things like that. But in terms of building some scalable like Donnie Epstein's done, or different people have done, where they really niche down to something unique, and then they train trainers and create a whole thing out of it.
Yeah, and I started into that about 25 years ago. I was working at that a lot, and it started feeling too creepy. And and the people that want to franchise and develop those things usually do it at the expense of their customers, their patients. So I stopped doing the high volume things because it felt wrong.
That's a good reason.
So ethically, I couldn't do it. And
did you find that when you would train people, that it was difficult to get them to stay in integrity with the model, and that they would want to speed through patients and not really do it right just to fit more in a day, or that kind of thing?
Certainly there are some like that, and there's other people that have integrity, but like I kept expanding. So if I was working on skulls, and then I start worrying about orthodontia, and there's techniques where I've pulled faces forward every day to help people grow their faces out, and other things that I keep getting interested in. I always figured that if it was all mechanical, that to me that was all part of the same ball. And a lot of my students didn't feel that way. They said, "No, we're not going to do. You're going to start working with dentists. Nope, that stuff we'll leave out." It's like, but if you do that, there's a whole segment of your population that you're not going to help. And so I had to quit that. I couldn't teach that. And then also the stuff that we've been developing more recently is so specialized that I don't know how to teach it.
I don't know how you would teach it either, especially with the two of you, with you and Rebecca working in tandem. I mean, it was unlike any. I've had a lot of different healing experiences and all kinds of different body work, and it was really interesting, actually, because I was expecting kind of just to come in and you do the nose thing and
right,
pop the balloons and we don't pop them technically, but pop them open. It was just kind of that, and thought it would be relatively short. But you guys really spent time with me, and it was very apparent to me that you and both of you have a really strong intuitive sense and are going around my body, adjusting different things, doing things that I didn't even understand. But you could tell just kind of by looking at me, the right hip's doing this and the toe's doing that. And it seems like you have an innate ability to see into the body in a unique way that's not trainable, because not everyone has that ability, frankly.
Well, see, for Rebecca and I, we've both been in it for most of our lives, and we're getting older, which is good, because that means we're really experienced, and we've been at it for a long time, and we've not quit. So we're getting better and better, and that's because we're not finding people that want to be on that path. That's so permanent dedication,
Yeah.
And for most people, it's something it's not so much a calling so much as it's a profession. It's something cool. And
right,
when you're made to do something, you have to pursue it deeper.
I understand. Yeah. I think I was made to talk to interesting people. I can't imagine never not doing this. It's sort of like, I always tell this to my guests, and usually it's off mic afterward, but I'm just so pleased that I get to do what I would do anyway. It's just almost like sometimes I feel like I game the system. Like, say I was just a regular guy and I went to your website and said, "Hey, I just want to talk to you for a couple hours for free." I mean, if you're a really, altruistic, kind person, you might have some mercy, and give me some time. But frankly, probably not. Most people, they're busy. People have, things to do. But when you have a microphone and a platform, I find, wow, I can talk to almost anyone and ask them all those things that I lay awake at night wondering, why does he do the balloon like that? Who filled it up? This is the shit that I'm curious about. Mm-hmm. So it's really fun to be able to chat about it. I'm also curious as to, and I've sensed that you're not someone that puts down other people's way of doing things. You just found your lane and it works, and you just kind of stick to it and keep innovating what you do. But I have noticed with chiropractic, which I love and think has benefited me a lot, that I've not seen, and I've been pretty committed at various times with very qualified chiropractors, I've not seen a permanent change. It seems like, and maybe alluded to this before, that the ligaments and tendons kind of just go back to where they want to be. But I always hope that I'm going to find like the right chiropractor, and my problems are going to be solved if I'm just consistent enough with it. But it seems the body just has a way of going, nope, this is nice for a minute, but we're just going to go back to what we were doing.
Right. So what I found, the reason that I started developing my work was because of the same frustration that you're having. So, except that I was doing it professionally. So I'm here after 1982, I'm charging people money to do these kind of services, and I'm really good at the popping and cracking and all that. Very proud of myself, full of myself. And then people would come back 2 weeks later and say, that was such a great treatment 2 weeks ago, do it again. And then they come back 2 weeks after that and say, do it again. I started to go, this is really creepy. At that time, I think I was 28 maybe. And I'm 28. And when I'm 68, these people are still going to be coming in telling me do it again, because I'm never going to get them better. What am I doing wrong? And that's when I realized that it was the stability patterns were not improving when I did that work. And anything I could do that would make a person more stable than where they are right now, their body will try to stay there. And if it's also more symmetrical, then they'll function better. So at one point, I had a massage therapist that started teaching classes in NCR massage. This was over 20 years ago. And they would do 4 days of just deep massage, but it was in a way calculated to make the person look more symmetrical. And they got long-term changes. They were taking pictures 2 months later, and the people were still better with massage. But it was way slower than if we went in and released with the balloon. So that's why we've stuck with that, because this work is so much more powerful that way. So we can make huge changes in picture. As you know, you can see the differences in pictures every few days.
Yeah.
The people are standing different. The bones are in different positions. The skin hangs different. The wrinkles are different. The blood flow patterns are different. Their brain works different.
Have you or anyone done any quantitative testing with like a QEEG or HRV or live blood cell analysis? Have you ever done kind of a before and after treatment to see the instantaneous
and
change?
it's not been predictable. So I didn't ever spend the $8,000 and take the extra classes to do the live cell myself.
Yeah.
And that's what I probably would have had to do to figure out what I could really see.
I always just find it interesting to see how a body responds in a clinical way like that. I've done quite a bit of neurofeedback, and I mean, you can see just you change the way you think or feel about something, and your brainwaves just start to follow suit. I find it really interesting to see how the body responds to these types of interventions.
Yeah, in 2009, in Australia, a chiropractor psychologist, he had dual licensure in Australia, did do outcome urinalysis on a group of patients that I treated.
Really?
Yeah. And he did say that their brain chemistry changed and they were less depressed statistically. But it wasn't quite a large enough statistical sample to publish.
Right.
So I think he did 12, and he said if he'd done 20, that he would have had enough to publish it. But he said, it looks like what you have is a antidepressant therapy.
I'll be damned. I got the sense, based on, again, doing a lot of neurofeedback and having a rough idea of what my predominant brain waves are, based on how I feel subjectively, it seems like what you do puts you in a fairly pronounced state of alpha. Mm-hmm. I don't know if you've ever...
Oh, I agree.
Yeah?
Yeah. Well, you're way more relaxed, and you're more chill, and you can think more clearly.
Yeah.
Because that's where your brain's supposed to be.
Yeah, that's the way that I like to feel. I mean, I love to meditate and just go theta and like zonk out. But in terms of waking state, doing things, interacting with people, I love that like relaxed, focused feeling. That's just it's the lane that my brain really likes to be in. So if something seems to achieve that, it gets my attention.
Right.
And I'm like, I want more of that.
And that's what happened to me for the first time in like 1980, maybe. I had my first experience of this self-administering.
Oh my God, you did
on
it to yourself?
That's how I learned, because nobody in my class at medical school would let me work on them. I said, we can trade. We can both learn about this. Yeah. You see what a nice business this guy has, and he's helping all of these people. Yeah. And they all said, you're crazy. They even started making these weird X signs. If I started walking up to people with a certain look on my face, they'd put the X thing out, no balloons, no balloons. And we go to our 30th anniversary. This was a few years ago, and they did the same thing. I walk in and they're shuffling around in their bad backs and stuff. And I said, and they go, yeah, I know, we could do balloons. I said, yeah, you're crazy.
So
I said,
funny.
no, you're injured.
That's just wild to think about self-administering that particular treatment, because it's so kind of momentarily shocking.
Oh, it was much worse for me than what you had.
Be tough to pull the trigger. I think I'd be sitting there going, do it. Sometimes when I'm doing my, various injections of peptides and things like that, it's like, oh, it's so hard to just get that first little prick of the needle in there. But if someone else does, it doesn't bother me at all.
Yep. Doing self-administering balloons, I don't recommend it.
Yes, thank you. For the record, we will state, don't try this at home, kids. And if we're affecting neurotransmitters positively, I would guess that it's possible that we're having an effect on the hormones too. Have you looked into that at all?
Yes. In fact, we've had some people have big pituitary changes with treatment, but they're more anecdotal, but they are people that I've treated. So I've had women who had thinning hair across their entire head because of hypopituitarism, have their hair grow in solid, and
I wish that would happen to me.
Have their periods normalize and stuff in their late 30s and early 40s. And that was after 20 years of irregular periods and diffuse hair growth. So the women will have that sometimes because they just don't put out enough hormones, see. So anyhow, we've had that. And we've had some men have their testosterone levels increase from this. Not routinely, though, I have to say.
Yeah.
And then the other one that we have had more results with has been basal body temperature. Basal body temperature is improving from this treatment. So that was somehow changing thyroid function.
Wow.
Yeah.
So interesting.
It's all the brain.
Let's see. Where do I want to go with this next? Oh, I know. I've heard you talk about, I think it was your nephew or something that was just born, and you did a treatment on him or her.
Him. Yeah.
Is that story right? And if so, have you treated other children, and of what ages, and what has that experience been like?
JD was my youngest patient. He was only 2 hours old when I had to treat him. And it was because my sister called from the maternity room and said, he can't nurse because his nose is blocked. Get over here and fix it. So we went over to the hospital, and my 10-year-old daughter, who's now in her 40s, leaned against the door, and I got my equipment out, and I put balloons up and treated the baby. But I have been treating babies I'd already been treating babies even at that point, and ever since. It's wonderful therapy.
Wow.
Because you can move them in a few moments what would take months or years as adults, because they're going to grow in that with those bones that you help align.
Right.
And so it's wonderful. It's so cool.
And isn't some of the misalignment that we're dealing with when you see someone with a unsymmetrical face, et cetera, from the trauma of birth, of squeezing through a small space and being so malleable?
Yep. A lot of times, especially with pointy heads. So people will come out with pointy heads this way, or their head will be really long, like a turban. And those are the two kinds of baby head shapes that come out. And normally what's supposed to happen is that the joints are supposed to stay loose enough that the connective tissue can just allow it to shift and the bones round out. But if the joints are jammed a little tighter, kind of like ratchets in a socket wrench, they get stuck and you start growing with that. And the kids that don't have soft spots, like on the top of their head and in the back of their head, because you have a joint in the back of your head that doesn't close until you're 6 months, it's just cartilage, and the one up on the top of your head is 18 months. And so that's where your bones, the skull bones, are rapidly growing until you're age 2 for your brain to be able to grow. If those soft spots aren't there, then your brain stops after a 6-month growth, and then you're what they call a moron. And a moron is actually a psychology medical word for someone that's so stupid that they're incapable of understanding that they can control bladder and bowel.
Really?
Right. So they literally sit around and they're so stupid that they shit their pants and they can't do anything. And that's a moron.
That's where that term comes from?
It's a medical term, moron.
I didn't know that. I'm going to bring it back then. I thought you couldn't say it because it was not politically correct or something. So thank you. I'll just hold the dictionary up if anyone gives me shit. You moron. There's a lot of things you can't say now, people get too buttered.
Right. But anyhow, that's because their brain can't grow. So like if a kid doesn't have soft spots when they're newly born, they'll scream a lot because they're in chronic head pain because their head wants to grow, and it's like a pimple that needs to grow, right? But if people like me work on them every month or so, you can loosen up those joints enough that they'll keep growing. And if you keep doing that until they're 2, they'll have their optimal brain growth will be available to them. And if you do that much work on them, their head will be really symmetrical. So the kids I've done that for who didn't have their soft spots, and I worked on them all the way up till they were 2, they tend to be later the smartest kids that the family's ever had.
Wow.
Because I think it's just optimal brain function. The other kids could have had it.
Yeah.
I don't think it's superior genetics because these are the same family. So
that's so interesting. Yeah. I've noticed that too. I'm starting to think more about kids, with the fiance and all. And so I always remember those questions I find are coming into my conversations a lot more. I'm like, oh man, I got to start thinking about this stuff.
And then then on that same line, then we also want to work on the mother first, because as we release her head and pelvis, then she has a smoother and easier delivery, and there's less trauma to the baby going through, so then there's less for me to fix later.
Oh.
So that's what I was doing when I had a family practice, is that I wasn't delivering babies, but I would take them all the way to their 9th month, doing all their structural work so their pelvis would be right, and their nutrition would be right. And then the baby, they would bring them in soon afterwards, and we'd start working on them to make sure those kids are right. And then we would figure out which foods would be sensitizing to the kid. And if we did that, then the children would never have earaches. They wouldn't have much of any head colds because we'd work on them first. And then they'd be smart. And then they would also fall down less because they'd have better balance and stuff, right? Because their structure's right.
Right.
So to me, that was just the way that you were supposed to be in family practice, right?
Yeah.
You fix those kids so that they grow right.
Yeah.
If you were running a nursery, you want your plants to look right. What is it with these guys that just inject? It's like going to a nursery where the only thing they do for their plants is put chemicals on.
Right.
It's like, come on, don't you groom? Don't you take care of them?
This sounds like a good strategy of biohacking the babies. By the way, my baby Allison, if you're watching the live stream, get ready. We're going to go see Dr. Howell. I'm always imposing my, my wacky biohacking stuff on her. But this makes sense, actually. This is not too wacky.
And it works.
That's important, right? A lot of the things I try personally might not be that effective, but I do them anyway to find out.
Right.
That's very interesting, though. Yeah, that makes a lot of sense. And along the lines of seeing the difference in kids, I've had the experience on multiple occasions where I'm around someone and they're young kid, and I'm looking at the kid going, this kid is not like a regular kid. This kid's different. They're brighter, they're smarter, they're more alive. And I started asking if those kids had been inoculated. And to no exception, every single time I've noticed that, the parents have been like, yeah, they didn't have any shots.
Exactly.
It's crazy.
It's
crazy.
Not. It's the information that was available. It was the information available in the early 70s. I've been a vaccine opponent the entire time. So my children, the mother of my children, against my wishes, did vaccinate a couple of our kids. But I caught her the first day. So I caught her after the first injection because I could already see the changes in my son's iris.
Really?
A couple hours after the injection. And I looked up at my wife and said, you injected them. She paled. She goes, how did you know? I said, I can see it in his nervous system. Could you do that?
Wow.
You B-I-T-C-H. Yeah. Terrible. I was so upset.
Yeah. Yeah. I've heard stories like that. It's difficult when you have two people with opposing views, because I'm sure obviously her interest lied in doing the right thing for her kid.
Fortunately, when I could see that reaction only a couple of hours after the injection, she realized that it was a physical response that was adverse.
Right.
And that convinced her, at least for a number of years. So the next child didn't get any, and he's 37 now, and he had no vaccines yet and never had antibiotics either.
Oh my God, really?
Yeah, that's Derek, the one that...
Derek's superhuman.
Yeah.
Like who could say that at 37 these days? You know what I mean? Everyone's at least had a few runs of antibiotics.
Exactly.
But there's possibly a correlation there, right? No need for antibiotics because the immune system wasn't compromised by the early damage.
Like he says, I had a cold once. I know what it's like to be sick.
Wow. All right. Well, I'll tell you what, I'm glad I live in Texas right now. I'll tell you what. What about TMJ? I interviewed a guy, don't let me forget this. Oh, Jesus Christ. Dr. Jennings, Dwight Jennings out in Oakland. And he's a TMJ specialist. And he does some quite unique things. He's kind of got his own thing going on where he has a different way to assess your bite and these appliances that will bring your jaw forward or backward. And he went deep into, and it's a little over my head scientifically, but he went into something called substance P. Not sure if you're familiar with that. It's kind of an inflammatory response type thing that comes from teeth grinding and jaw misalignment and stuff like that. And similarly, in his work, he finds that there are a cascade of other benefits that come from a result of aligning the jaw. Mm-hmm. So I'm wondering how the work that you do relates to the jaw, since you're dealing with the whole skull.
So the idea for the dentist to be doing this, I always find kind of amusing, because they're specialists here, and most of what you need to change to fix the TMJ is here.
He's reaching the back of his head, by the way, for those of you listening.
So we have to work with the whole head. So, more or less, your maxilla, the cheekbones and down into your teeth, and then your mandible, where they meet together is over by your ears, where your jaw touches the temporal bone. That's why it's the temporomandibular joint, TMJ. It's over there. And there's ligaments there too. So it is true that when they work with enough splints and stuff and get it to where the two temporal bones on each side of the head are aligned just the same, then and they have enough shims and stuff in the mouth, they can make it all really smooth. And I'm sure that the people will feel better, and there will be less inflammation, and there will be whole cascades of chemical improvements. But the way that I would prefer to approach it first, instead of going to the dentist first, is to do the cranial work until we can get the occipital back of the head. We get the back of the head more lined up and get the temporal bones aligned and get the face bones loosened up, so we have some general symmetry, and then we see how the jaw hangs, because it should swing like a door. And, if the hinge up high on the door is messed up and the one down low is good, then the door still doesn't open and close worth a hoot. And if the house shifts, then the door doesn't work right either. So the dentist is the specialist in working on the hinges. And they're really good at it. And they work with the surfaces of the door and the hinges until it gets... But I'm the one that's going to change the house. And I'm going to make the house level out until that door swings smooth. And then we can go in and see the dentist for the fine work and change the rest,
Yeah, that makes sense.
And that's worked better, and then we have fewer of the $30,000 disasters.
Right.
Because you've met those folks.
Yeah.
The $30,000 dental disasters where they thought they found their guy that was going to get rid of their TMJ, and it didn't. And it's not just mechanical, the stuff that I find that works. Mm-hmm. The other thing is that we're finding that we need the right radionic rates, which, we have medications that are broadcast medications into water because they're radionic rates, and they change, and they're to get rid of the tetanus vaccine residues that tighten up the ligaments in the jaw area. Remember the word tetanus, the common name for that disease is lockjaw.
Oh, wow.
And if you've ever seen pictures of people in Eastern Africa that are missing their lower central teeth, and you think, what bad dentists they have. But like Kenya and Uganda and stuff, you'll see people missing their teeth, especially my age. Mm-hmm. And that was because they used to pull those teeth on the kids so that if they got lockjaw, because they were around a lot of animals like horses, cows, sheep, and with the hooves, if you get around the poop and get it in your cuts, you can develop lockjaw.
Wow.
And so they give vaccines for it now, but what would happen if you got it before the vaccines is that your jaw would lock for like 6 months. So they would, and then it would use up. So they would just pull the teeth in the center, and then they could get a straw in. So if you develop lockjaw, yeah, you can't chew for 6 months, but here's the straw. Drink your meat pudding, But that's what they would do.
Oh, that's brutal.
And so, but when they give you the vaccine, they give you the toxin residues are in there, and so they create most of the TMJ. More so, but of course, you can have the right kind of accidents. Face through the windshield ones, that kind of does it good too. People that box and get knocked out in the chin, they'll get TMJ problems. But most of the other people, it's actually the vaccine reaction. So if we start neutralizing the vaccine, we'll start loosening it up, and then we can do the NCR and make the head symmetrical. Then we can really treat the problem. It's really good that way.
Back up to the radionics.
Oh, yeah.
Yeah, explain that, because I'm barely familiar with it, but someone listening probably just went like, wait, what was that last part?
So radionics, it looks like radionics is how it's spelled. And if you look it up in the Library of Congress, it's considered an occult technique, but it's not. It was actually developed originally by a professor, one of the medical professors at Stanford University in 1924 named Albert Abrams. And he found that using dowsing type skills that he could have people turn different directions and he could diagnose them. And dowsing skills meant like water witching skills. So like the way water witching people will use a wooden stick cut in a Y to figure out where the well should be. He found that he could do the same kind of techniques on his patients and then develop machinery that could be used with this to diagnose the same kinds of energy. And then after they found out they could analyze, they also found out that they could rebroadcast what would sound almost like a frequency. They called them rates. And this field is called radionics. And it was called radionics because of a Ruth Drown, who was a chiropractor in New Jersey, who called it, who would treat patients at a distance. Abrams always thought you had to treat the people more or less around there, but she found out they could be anywhere. And she could analyze them at that moment if she had a lock of hair or a photograph or even some spit that's dried up on a Q-tip or a piece of blood. Wow. And so she could analyze them wherever they were. And they started putting resistors in parallel. And then they would and then watch these platforms change place. And then later, I was the last student of the only guy that got radionics equipment patented. And his name was Galen Hieronymus. And I had that's an interesting story. That's a long one. But I ended up studying with him, and he was the guy, he was 91 years old. I would fly down to his house, and I didn't know that he was doing this. He would hypnotize me so that I could learn enough information because he knew that his days were numbered.
Wow, no way.
And so, yeah.
So he would like put you into a theta programmable
state? I mean, he would always start it out. And we were talking about the electron and about how as the electrons get closer to the nucleus, there's more energy. And then it was, Galen, that's long enough. We're going to dinner or lunch now. And I'd say, but we just started. He says, no, it's been 4 hours.
Wow.
And so it took me years to remember it. Yeah, kind of strange. But anyhow, it was about radionics. That was the point. He was the guy that formulated that. And now there's thousands of medicines that people develop with radionics equipment that they can broadcast into crystals or into water or with photographs or something. They can literally broadcast it directly to the person, and you can treat different kinds of conditions. So, for instance, there's now some stuff that might work to neutralize the vaccine chips.
Wow.
Because you know that there's programmable technology in the new vaccines, right?
Yeah.
And so those are actually nanobots that broadcast a signal. And there's engineers that we know that have found those nanobots in themselves and had to neutralize them. They said it was the same kind of nanobots that they had done government programming with, but not as sophisticated as the ones that they have used in their high technology jobs with the government. And there's 4 or 6 kinds of chips in the vaccine, according to the Moderna website. It's injectable, programmable technology, it says, on the Moderna site. So there's nanobots in the chips along with the messenger RNA. And that's to facilitate the injection of the messenger RNA into the DNA of the cells so that we can create the synthetic humans.
It would sound like science fiction if it wasn't verifiable.
And so the same people that program nanobots and stuff work in these other fields doing good things, with radionics, but radionics has also been used for bad things.
Right.
And because any technology, right, it always has a potential for abuse.
Yeah, absolutely. So when it comes to neutralizing, the negative
tetanus shots,
negative
for instance,
effects of
that we can
tetanus.
do routinely. It takes 3 different kinds of remedies, and it takes a few bottles. We always have Rebecca and the guides tell us how many.
I want to get that because when I was a kid in Colorado, I used to spend a lot of time just running wild. And on one such running wild day, I was in a little ghost town. They still have these old kind of ghost towns. Just you'd see like an old house from the, late 1800s, just kind of half sitting there. And I used to go screw around in there and shoot guns and look for lizards and whatever. One day I was in one of those and I jumped off something and put a nail, old rusty nail through my foot. And it was incredibly traumatic and painful. And I went and they gave me a tetanus shot.
Yep.
And I never thought about it, actually. I didn't even realize that was a vaccine until you just said that. I was like, I had one of those shots. Now, I don't have, at least that I'm aware of, TMJ, but if there's a way to get that shit out of my body, I'd sure like to.
Yeah, I've done orthodontia, directed it on myself and had a lot of these treatments of mine. So my jaw function was really smooth, and, no popping, clicking, no pain. And Rebecca and the guides kept telling me I had to treat the tetanus out of my body. And I said, I don't have TMJ. Why are you guys bothering me about this? And so finally I said, okay, I'll just do it just so you won't see anything. And my face came out about a ½ inch.
Really?
It took about 2-3 weeks.
Wow.
My face came out about a ½ inch. I went, oh, geez, they were right again.
So when you and or Rebecca use radionics to program some water, are you programming a frequency or something into it?
Well, what they call it is rates, and that was what Galen Hieronymus never taught me about. He wanted me to understand it conceptually and how to work with it and all that. But he did take one apart and show me some stuff a little bit about how the prisms and stuff, but he never told me exactly what it was.
So it's actually
his machines
a physical technology, a machine?
Yeah.
Oh, okay.
He had 2 capacitors, and then he had there's a prism set between the 2 capacitors. And then there's also lenses to focus the eloptic energy. The energy that is patented in a radionics machine has both electrical and optic properties. So it can be spread out with a prism, and it can be focused with a lens, and it can be run through wires.
Wow.
And so it's a combination of those things. And then the dial positions of the 2, it's sort of like because of the prism in there and the lens, it's functioning like the 2 capacitors are at a 90-degree angle to each other. So you get sort of like a 4-dimensional energy form. And so based on the dial settings and the intention of the operator, then you can put in substances or broadcast that thing to people. And it's a physical commodity.
Wow.
But it's not matter.
Got it. Yeah. Well, it's funny because the interview before you was with this guy, Philip, a German guy from a company called Lila Quantum Tech. And in not that dissimilar of a way, they're able to program different frequencies into various objects that do different things.
Right. So the radionics definitely does that, but it isn't actually a frequency because it's a capacitor setting.
Interesting.
Yeah, and then they'll set up now, they've got machines that Galen didn't ever develop, and they're actually having ones that can use 4 capacitors, and they have them, so those are multi-dimensional, larger dimensional energy objects that they're treating with.
Wow.
Yeah.
So cool.
So it's really cool stuff, and I don't understand it well, but Peter Radati, our business partner in the flower company, he is the best-selling radionics author on Amazon.
Oh, interesting.
And he's the one that's designing these machines for KRT, the biggest company that manufactures radionics equipment. And those guys are making Galen Hieronymus's old designs, and now they're finally deciding that his designs, being 80 years old, should be replaced. And Pete, our business partner, is the guy that's designing those machines.
Oh, that's so
So I
cool.
worked with the previous designer, and now I work with the current designer
That's
of
crazy.
radionics technology.
You have a karmic connection to radionics.
Evidently.
That's wild. Oh, that's so cool. I can't wait to explore that. I'm glad we got to cover that too, because I remember you mentioned that when we met in LA, and you said, "Hey, let's talk about radionics on the show." And I'm glad we did. That's fascinating. I feel like we could have a much longer conversation about that alone, because it's just it's hard for me to grasp. So I'm imagining people listening that have never heard of it at all are like, "What?" But that's pretty incredible. What about migraines? What do you reckon is, I don't know that I've ever had one. I've had some pretty gnarly headaches, but I have a feeling migraines are a whole different animal.
They are. And in, let's see, what year was it? About 2001 or 2, we did a study here in Texas, actually over in a suburb of Houston. We, two of my students took a dozen people that had migraines that were bad enough that they had their imipramine prescriptions ready to inject if they got the symptoms that their migraine was coming. So they'd give themselves their shots. So they were medically totally diagnosed. And we did, my student, osteopath in a little town outside Houston, I don't remember it now. And she did 4 days of treatment, waited 3 months, did 4 more days of treatment, and waited 6 months and did a follow-up. And at the follow-up, 92% of the people that had come in for treatment said that their migraines had either stopped or were sharply reduced. And so then the other doctor that was pretty impressive.
Damn.
And so then we wrote it all up to publish. And that was John Trowbridge. He's a doctor in Houston. He writes beautifully, and he's widely published. And he wrote it all up, and nobody would publish it. They said you had to falsify the results to have that effective treatment. Yeah.
Wow.
You had to falsify results because no treatment is that effective.
See, that's why medical progress is so freaking slow, right? It's like if something really works, then, no, we don't want to talk about, you didn't do it right. We don't want to talk about that. It's crazy, or that it's not, I guess it's outside of the common narrative.
Right. Or we'd have all the people say that they were better. We'd show the photos that they were better. And they said, well, you falsified the photos. I said, how?
Right.
They said, well, with technology. I said, I'm really bad at technology. Well, you hired somebody else. Who? They have the photos. Look at them. See if they're real. They're digital.
I mean, I can assume based on, the earlier part of this conversation, though, if your skull is not in its designed, intended shape, and then you have the cascade of all of this other misalignment, that headaches would be like an
easily created.
An obvious consequence of that, right?
And people do get better when they have headaches and they have people fix the first bone in their neck, the atlas, right? Mm-hmm. So a lot of people can get relief temporarily from getting that bone fixed. And that's because that is where the pain often is coming from. It really is that vertebrae out of position pulling on the top of the spinal cord where it turns into your brain stem. That's where the big hole in your skull is. The problem is that the treatments that are often done are temporary, so the problem keeps recurring. So the bones in your neck slide into different positions based on how your head balances on top of your neck. That's based on the alignment of your face and head bones. So is your head rolling off to the right or the left? Does it want to tip forward? Does it want to tip back? Have you had a lot of teeth pulled so that your face collapses more? Then your head wants to flop forward, right? So then what your brain does is it moves your head around on top of that atlas until it finds the place where it balances the best. And if you're in that position where it's way off center, now you're in a position where you're going to have headaches almost any time you want, or it might never even stop. So until somebody changes your head alignment so the vertebrae that's holding it up can slide into the midline, then the pain stops. So, seeking the temporary relief, that's the people that massage or manipulate the neck or use certain kinds of drugs or whatever. There's nothing evil with that. It's not fixing the problem. They can say that they cure aspirin. They can advertise that they cure headaches with an aspirin.
Really?
Yeah, legally, they can call that a cure.
Wow.
But if you go online and you say cure, the FCC will shut you down.
Yeah, it's always interesting interviewing people, especially if what they do is effective, because we always have to tiptoe and dance around, if they're, if they've monetized their expertise or product or whatever the case may be. Yeah, it's funny for me. I was like, sometimes the conversations off camera are a lot more revelatory because someone can speak freely without being
So what I've done,
punished.
just so I can speak freely, is that I practice as a minister now instead of as a doctor.
Oh,
I
there
have
you
a
go.
doctor license still,
Yeah.
but my practice is as a medical healer. And I'm a Catholic minister out of the Eastern Orthodox Church, which is in Brazil. And
Really?
we're part of the Church of Hope. We're part of the Sacred Medical Order of the Knights of Hope.
Wow.
And my business, church is called the Church of Divine Structure.
That's great.
And our online store is a service of the Church of Divine Structure, and the NCR Clinic is part of the NCR Healing Clinic is a function of the Church of Divine Structure. And,
that's why you could talk about the
and
the
so
shots.
I talk about everything openly,
I like it.
because
I
this
wish
is all
every guest
religious
would-
stuff.
I wish every guest would convert. We could talk freely without
Well,
getting
not only
shut
that,
down.
it just lets people have the right to choose what they want.
Right.
Instead of having some guy in the state capitol determining what you can do. Why
Right.
should that person decide what you should do? If you and I agree, that should be enough, right?
I agree. I agree.
Yeah.
Yeah. Sovereignty and autonomy. It's a rare commodity these days. So when I saw you, we did 4 treatments inside of a week or something like that.
We did 4 in 4 or 5 days.
Yeah. And it was great. And I got the sense from it, since I felt so good, and I look in the mirror and like structurally there's changes, that it's something that one would want to do. If someone's relatively healthy and they just want to optimize, they don't have any pathology per se going on, what does a typical treatment schedule look like?
If they're in a hurry, they would see me every 4 to 6 weeks for 4 days. See me a half hour a day to remove most of the obvious traumas in their head and so forth. If they have deeper problems after their head is loosened up, then we can start accelerating to longer treatments. And for most people, if they do 4 to 8 4-day series, that's enough for a person that doesn't have a significant trauma history to be a lot better and to have it last for years. Barring new accidents, you can go 10 years without seeing me after that and be pretty good. Although most people like to see me for a little bit every year or so just to remove the stresses of the last year.
Right.
But still, like there's one woman from Hawaii that every time she makes her headaches come back, she flies to see me.
Right.
And she started seeing me 20-something years ago. And I think I've seen her a total of 3 4-day series.
Oh, wow.
Because I haven't had to see her for like 5 years. And she went 10 years before that. And,
And you seem to travel quite a bit. What are the different cities that you visit? And is that something that's going to continue?
Well, what we've been traveling, I've been traveling around the world a lot for the last 25 years. And at first I thought it was really cool. But also I was in a licensing battle with the state of Washington in the early 90s. They removed my license for giving B12 shots. And this was just the beginning of all the junk that's still going on. And the way I got my license back was that I hired an attorney from a company called Bogle and Gates in Seattle. It was the biggest law firm in Seattle, owned by Bill Gates' father.
Oh, no way.
And what he had me do was bring him $10,000 in cash. And this was after 3 years of not being able to get my license back with other attorneys. The courts all denied me, and I had never heard anybody. And I gave him that money, and 1 month later, I had my license back.
Oh, my God.
So is there corruption in the world? I suppose so.
Oh, my God. That's wild.
But that was 28 years ago. So
Right. And so what's your travel schedule look like now?
So we have still been traveling we're still regularly in New York because that's where Rebecca's from, and we go there to see family. We're still regularly going to Philadelphia and Denver. And then we've just split in 2 in Los Angeles. So we're actually going to Orange County, Costa Mesa, right by the Santa Ana Airport, John Wayne Airport. where Derek's office is, and then we're working out of LA. And we're looking into doing 2 tours a year in an RV, driving cross country
cool.
because we're having so much trouble flying.
I know, man.
And also, we're just tired of the packing and unpacking.
It's brutal.
Because I haven't had days off for the last 25 years for the most part because I've been traveling.
Yeah, I like the RV idea for a number of reasons, but I'm only going to sign off on it if you make Austin a stop. It's like, I got to do more of that. I was already thinking about it when you're on your way over here. I'm like, oh man, I wonder how long he's here. Like, because I don't feel like going back to LA. It's so funny that
I understand.
The moment I left, I've thought about my friends, but I miss it 0%. Like the minute we crossed the line and into Arizona, I was just like, peace, I'm out. I'm so, I've been wanting to make a move for so long. So the idea of going back to, God bless that city. It was good to me, but it's time has come for me. But the idea of going back there, I'm just like, I could just picture LAX and like,
Well, at first I'm going to go to, we're going to go to Sunset and 405. The hotel, the Round Hotel, the hotel in Angelino used to be the Holiday Inn.
I know that hotel. Yes.
Right.
Yeah.
I used to in the early 2000s. I worked there for years, and I'm going back temporarily until we resolve the RV thing.
That's great. I like the RV idea, though, man.
I think it sounds really cool.
Yeah, it's the future.
And then I get to stay home part of the time, and then travel the rest.
Yeah.
You can always come and see me up in the Okanagan, and.
Cool.
We have our diner up there.
Oh, that's right. Yeah,
so you can eat really well, and it's beautiful.
Yeah, you live out in the sticks in Washington, right?
Way out in the sticks.
Yeah.
10 miles outside of town of 900 on 200 acres, and we're growing that.
Oh, that's so cool.
Yeah.
That's so cool.
Yeah, it's
Good
really
for
cool.
You.
So you can come out and get treated up in a small town, but we have our keto diner.
That's so awesome.
Yeah.
So the diner
is going.
It's keto?
Yeah, it's a keto diner.
No way.
With local grass-fed meats.
Oh
and then
my God.
the baked goods that we've developed for our company that has the zero carbohydrate baked goods.
Yeah.
So you can come into our diner and you can get a hamburger with a bun, and it's totally keto, the bun.
Do you guys have a website for these baked goods yet or anything?
Well, it's going to be up by next week.
Okay, well, make sure to send me the links and we'll put it in the show notes. Because honestly, I'm not blowing smoke because you're my podcast guest, but these freaking brownies that you guys make and the bread you gave me last time, and I'm not joking, it is literally the best keto, like non-grain type of bread products I've ever had. I mean, the chocolate, those muffins are out of control. It legit tastes like real chocolate cake.
Yeah.
Like real deal Holofield.
I think it's better than the kinds I've eaten at famous bakeries.
It's really good. So I'm telling you, you were doing a great service to humanity for those of us that like me don't want to eat carbs and gluten and sugar and stuff, but cave, due to wanting to live life. Right. So if one can live life without, wrecking their gut with glyphosate and all the rest of it, that's a huge win.
You can have chocolate. You can have cake.
So good.
She can make cakes and stuff like with this stuff. Oh, that are so good.
Yeah.
You like marzipan, you like vanilla pound cake, you want chocolate cake.
I want all of that.
I like the chocolate ones with all the chocolate chips in them. That's what I've shared with you. Those are delicious.
Yeah, and I have 2 in my bag. I almost wish I didn't say anything because I would eat both of them on the way home, but I'm going to save one for my dear
No, it's
Allison.
better to savor them one bite at a time because they explode into your mouth so much chocolate. You eat them fast and you just lose it. But I mean, you still can taste it in your stomach. What I've noticed now that I can eat really clean food is that when it's an empty stomach and then I eat something that's really clean, I can still taste it in my stomach. It still tastes like chocolate.
Interesting.
But when I eat other kinds of food and they have weird chemicals in them, they taste like chocolate in my mouth, and they go down there and they don't taste like chocolate. But they taste like chemicals.
Right.
So this stuff, it still tastes like chocolate. It's so cool.
Right.
So always eat it on an empty stomach at first, and then notice how you can taste the chocolate. And you can do the same thing with burgers and stuff. If you use the right bun and the right cheeses and stuff, you can still taste the food after you've eaten it a long time.
Really?
Yeah, it's really neat. Yeah, and the parasites don't appreciate that. See, so you got to kill your parasites.
Right.
And then start eating real clean like this. It's so nice.
Actually, that was one thing I did want to ask you about, because I remember you developing some different protocol and stuff to deal with parasites. And I was reminded of that today when it sounds like this thing went viral because you got it too. But someone sent me a TikTok of this woman putting a pork chop on a plate and then pouring a Pepsi on the pork chop. And you literally see these little, look like mealworms, these parasites popping out. They're agitated and popping out of the meat all over the place.
They're trying to get away from the phosphoric acid. It's burning their skin.
It's just disgusting. And I suppose if you were to cook that pork well enough, you might get rid of them.
You can kill them.
But
that's the 165 degree business,
Yeah.
And some people like pork 180 degrees because they just freaked out by it,
Yeah, man. That was...
but you don't do sushi pork.
Right. Yeah. Well, that's the thing. I remember years ago when I was a vegetarian, people were really down on sushi too because they said the same thing. They're like, it's full of the parasites, and if it's not, it's full of the larvae and all this, And I've done a lot of parasite cleanses over the years, and I have never seen anything too dramatic come out.
Have you ever had ceviche?
Had some the other day.
Did you ever see worms come out?
No.
No, because the people that buy the sushi fish will only use the best ones for sushi.
Oh, okay.
I used to go down to the wholesale place in San Diego to buy my sushi fish because I was cheap. And I'd go down there, and the guy, I'd come in, he says, "You want the sushi stuff? Down to that end,"
Oh, wow.
And that's the only stuff that you should eat raw. The rest of this is only cooked.
Oh, okay.
And that's what he would do.
So you think eating sushi is generally safe if it's a reputable vendor?
I do.
Okay.
And you still be killing the parasites every 3 or 4 months anyhow. You got to.
Okay. And what's your, if you can describe it briefly, what's your protocol for deworming a human?
We have about 6 different compounds we use. So there's pine, there's paraffin, there's even some herbs, there's minerals that work really well. In fact, I'm in the middle of another detox right now because I've been experimenting with this new new for us mineral compound. Actually, it's from the 1920s, and so I've taken that. Rebecca and I've taken that formula, and then we've added a little bit to it, and I'm taking large doses of that. So I'm having all kinds of detox happening. So I've got my skin breaking out all over because of chemical stuff that's coming out, stuff that's dying, and so it's really interesting. We find different combinations, and we have the guides pick. Or combinations. We can't find that always the same thing works on each person.
Got it.
Because they have different combinations. And I have very weird parasites. So the ones that work on me will also work on other people. But the routine ones like roundworm, very common. It's a relative of earthworms. And so everybody that has asthma that I've ever seen in my whole career has roundworm.
Really?
Yeah, every person, ever. So virtually everybody.
I have a good friend with asthma. He was just out here visiting.
So tell him to start treating the roundworm, and 98% or more of the time, he's going to have it go away.
Wow.
Yeah, and because that's what makes him porous enough that he has the food allergies. So he's got to kill the parasites. That'll help a bunch, and then he has to heal up from the food allergies. And then he won't have it at all.
Oh, that's so interesting.
Yeah.
Have you ever you mentioned pine. Are you talking about that pine oil?
Pinene. Pinene is the terpene that's extracted from pine oil.
That stuff's harsh.
The cheapest commercial stuff is called turpentine.
Okay. Yeah.
Right.
Yeah.
And so you can buy for $7 a quart, you can buy pinene at Home Depot or Ace Hardware, and it works.
Right.
But you can also, if you wanted to get drunk, you can also buy some really cheap vodka, and it gets you drunk. Right? And it doesn't
Does it
kill you.
Parasites?
No. But the point is that you can also get more expensive pinenes that don't taste so bad.
Okay. Yeah, I was getting this, I think it was either Korean or Chinese, remembering the bottle. It had some sort of Asian characters on it, but I think it was called red pine oil, and there were these little capsules. And I heard that it was very effective for parasites, and I was taking it.
If you had enough.
But it was so strong. Like, even if you ate some food and took it, it would still just be like, when you take oregano oil and things like that, sometimes it's quite strong. It was like that, but it was too strong to even use all the time.
I've taken up to 6 tablespoons of pinene blends. And that gives you massive diarrhea.
I can imagine.
and then there are some mineral compounds that I've taken like 30 times, the normal dose.
Yeah.
And the acids and stuff that are in there. And I've had so many parasites come out from some of these things. It's
wow. So
really
you're
cool.
saying you routinely do parasite cleanses. You're of the mind that we just pick them up over and over again?
Well,
it's not a one and done thing?
Last week I did a pinene blend, and it was enough that I did just 2 days. I think I did a couple of ounces each day, but I could see worms about this long in the porcelain of the toilet.
Wow.
That's what had grown. Because we're continuously being exposed. We're breathing this kind of stuff in. But we've had some people that we've worked with roundworms that had roundworms over 24 inches long. And that takes a number of years to grow.
Yeah. I remember years ago, this was back in the 90s, one of my first big moves to improve my health and detox. I went to this place on the Big Island in Hawaii called Angel Farms, and it was a gravity-fed colonic cleanse. And they'd put ozone and herbs in the water. It was really, really cool. But more like a Kalima board, not pressure, just very gentle. Right. But for long periods, you'd have, 20 gallons go through you in a couple hours or something. But I did that, and that was about 12 days. And I was surprisingly just a lot of weird old black tar and who knows what, Matchbox cars and shit that I ate when I was a kid.
Right, but see, unless you kill the parasite, they stay attached to the wall of your colon or small intestine.
Right, because they're a little sucker head, right?
Yeah, they suck onto there, and then they impart chemicals into you to reward you for good behavior or to punish you for bad behavior, and then they eat out of your bloodstream. But they're not like a tick. They don't suck blood in. They just pull their glucose, or in the rare occasions they need, protein, they pull them right out of your bloodstream. They live there too. And they're also one of the voices in your head.
Right.
And it's not until you kill enough of them that the voice goes away.
That voice says, eat the pint of Haagen-Dazs. It's midnight.
It's those impulses that you feel. What should I call it? The WTF? The what the fuck?
Yeah.
When you have that what the fuck, I'm going to do that?
Yeah.
That's the parasite in a voice. That's in your head.
Well, where I was going with the Hawaii story, like I said, I passed with flying colors, but I had been doing quite a bit of detoxing and cleansing and parasite cleansing and stuff before. But there was a time kind of each day where there was, probably 5-8 people going through this little program, and it was in a house. Cindy Sellers was her name, a really amazing lady that ran it. But it was like if anyone had really big worms or parasites coming out, the way the Kalima board kind of setup is they did it in a tub and everything stayed in the tub, and then Cindy'd go in there with a long stick like a poker, and we'd all go look at everyone's worms. And some people had those like 2-foot. It looked like a freaking skinny snake coming out of their hind end, man. And at that point, I was like, oh, this parasite stuff is real, man. It was disgusting. I've never seen anything that gross in my whole life.
So when you hear people say, parasites don't happen in America, only in the third world.
Right. Well, and isn't
how funny it really is?
Yeah. There was one guy, man.
Just go to Walmart and look at those people walking around with those bowling ball shapes under their shirts. Yeah. Those are just loaded with parasites and fungus. That's what's in there.
Really?
Yeah. That's why they look like their bellies are just swollen with that stuff, because that's where they all live.
Interesting.
Other people will get them out in other places. So I had elephantiasis, these massive legs, because I had worms that were living in my thighs and down in my calves.
What?
They're called filarial worms. And they live, and they block the lymphatics, and it makes your legs get giant.
Oh my God, dude.
Yeah. So, so nobody recognized it because it's a tropical disease. And I developed it living north of Seattle as a 6-year-old because I got bit by a mosquito, and the mosquito had to bite someone with that disease, and then it imparted it to me. So we were active in the Baptist church when I was growing up. So it was probably a missionary that had been in the tropics, had that parasite. The mosquito bit them and then bit me right here, because I have a scar from it, right here on my thigh, on my left thigh. And my legs have been huge ever since. I got teased, why are your ankles the same size as your knees? And I always said, I don't know.
That's brutal.
They just are, And broken blood vessels. I had varicose veins when I was 14.
What?
Yeah.
Oh
because
my
I
God.
had worms living in there and nobody knew. I didn't know until I was in my 60s.
So what would you recommend? I had no idea this conversation was going to really go in this direction. And I apologize to the listeners that, are eating right now. But if someone's like, oh man, those symptoms sound familiar. I have a bowling ball in my abdomen. Is there any kind of website or certain products or like a protocol or one expert that one could go look up if they really wanted to get serious about detoxing parasites?
We are helping people on those kind of programs that we do on the phone and by Skype. And so that's the best I know of. But there's actually quite a bit of information about pining out there. There's an author named Walter Last, L-A-S-T, a medical doctor from Australia. And he's written about this stuff over the years.
Cool.
I don't like Jennifer Daniels' information about turpentine and pinene. She's a medical doctor, Harvard trained, lives in Panama, and I don't like her information.
Okay.
She has you take a teaspoon at a time with sugar.
And she says that, yeah.
And she says that the parasites will open their mouths to eat the sugar, and then you'll trick them by getting the pine oil in. And that has nothing to do with the anatomy of worms, so it's like an impossible explanation. Because they're suckers up against the wall,
right? And
so your blood sugar has to have a big surge for them to want to feed, and the pinene's going to be touching their body on the outside, right. And so you kind of like melt their body with pinene is what you do, and that kills them.
Got it.
And some of them that come out are having sex.
Are you serious?
The dead bodies, they'll have sex and stuff. It's gross. It's so gross.
I'm going to have to put a disclaimer at the beginning of this. Like at an hour, 20 minutes, you might want to tune out if you have a weak stomach. I guess I've been through so many phases and iterations of the healing journey, and I seem to be healthy. So I just kind of forgot about parasites. But I also thought that when you get lab work done and you get your stool samples, I always just figured, well, if I had any parasites, they would show up in that, and they haven't. Do you think, really legitimate stool sample lab work is an accurate way to assess whether you've got parasites?
What I found out is no.
Wow, really?
So and I worked with the specialty labs. The two best labs for detection are Diagnostics and Great Smokies. Mm-hmm. They're on each coast, and they miss a lot of them. It seems like everybody that we see gets better when we put them on parasite cleanses, and I've put some of those same people on the lab tests and been told that they were negative. So that didn't mean that they were like lying. It meant that their sensitivity of their detection wasn't sensitive enough to find obvious ones. Wow. So we just routinely assume that people will get better on that, and so far, we also have the guides for help, but every person that we've ever seen, we've wanted to put on a program like that.
Yeah. Okay, good to know. Good to know. Before we close, I would be remiss. I think the circles that I run in and the way my life is when someone is mentioning getting information from the guides, I assume they're talking about non-physical guides, and I don't even bat an eye. And knowing you and Rebecca and having worked with you, there was a lot of communication going on with, you guys are tapping into the ethers and
into something,
into the quantum, into something, and, getting guidance and kind of being led one way or another. Although I'm sure there are some people listening that are like, wait, who are the guides? What the hell is he talking about? If you're comfortable, maybe describing how that came to be in your practice and in your life.
So for me, the way the guides got into my life was that I know Rebecca. So Rebecca has had 5 personalities that give her all kinds of information that seem to reside in her brain. And she's had them since age 2. And so when she was 9, she called up 4 different airlines and told them when their planes were going to crash the next day. And then they did. And then the FBI showed up at her door. Boom, boom, boom. We're looking for this terrorist, Rebecca Hart. And she says, that would be me. You're 9 years old now, huh? How did you know this? I dreamed about it. So by the time she was in her 20s, she was working for the UN and other people like that. They were taking her around to weird sites and say, what happened with this spaceship? What happened in this murder site? And She thought that was too creepy, and so she went into medicine, and I met her, 8 or 9 years ago.
Wow.
And we seem to have like this intuitive thing for ourselves, and so the guides, I just follow through with them now.
Yeah.
And so I kind of linked up with them as well.
Wow.
And so,
what a gift.
Yeah. So it's really cool because that's, it's that kind of information that's gotten me so much healthier that now my gray and white hair, if you go and look at me at YouTube and see me in 2014 talking about the same work, you'll know by the voice. It's the same guy.
Yeah.
However, you'll see a guy that's over 400 pounds whose hair is gray and white. And now my hair has grown back in color. We have a few pictures of gray and white hair on the ends, and the roots are blonde,
right?
Because we've gotten enough of the parasites killed that my body is resetting, and it's growing new veins and new hair and new skin.
Wow.
We're getting younger, see?
That's so cool.
And so anybody can do it. I was in terrible shape.
Yeah, that's serious business, man. 400 pounds is no joke. And it's not like you're 7'2".
No.
You know what I mean? That's a heavy set guy right there.
It was size 50. When my size 50 pants started getting hard to close,
oh, shit.
I went, whoa. And now I wear 32s,
Yeah.
And it was 50s. That's a lot of difference,
Wow, man. I'll be damned. You got to do a lot of clothes shopping to make the new you.
I just keep going over to, the TJ Maxx and that kind of stuff and throw away some more clothes.
Yeah. Wow, man. What a great conversation. Thank you for making the time.
Me. It's fun.
So fun. I always have such a great time talking to you. My closing question is this, friend. Who have been 3 teachers or teachings that have influenced your life and your work that you might share with us?
The first teaching would be do unto others.
Yeah.
I learned that one a long time ago. I was in a Baptist church and never got baptized because I thought there were too many hypocrites in the church, but not because I didn't believe. And so that's one thing. Another one was finding out about radionics and working with Galen. I mean, it took me years to hear it all, but boy, was that life-changing. It was really cool. I was sent to him. I'll tell you a short story. I went to a convention up in northern Canada, and I went around introducing myself to all the old people because I was like 30 years old. My name is Dean Howell, and I would like to know you because you've been in practice for years. And this one woman started telling me about all these weird machines that she knew about. And I had already gotten radionics machines from a well dowser that had me buying that kind of equipment. And then she said, at the end of an hour, I said, okay, I'm ready to come to Waterloo, Ontario, and to pay you $4,000 and have you teach me how to do this radionics. She goes, it was decided years ago. I said, what was decided years ago? She goes, it was decided years ago that you would study with Galen Hieronymus down at his house in Georgia. And I said, I just met you, lady. Don't give me this bullshit. And she says, no, here is the phone number. Now you go call Galen. He's waiting for your call. And I said, how can he be waiting for my call? I just met you an hour ago. And you won't stop me the machine. And she goes, and she just walked away. That was it. So I was up in northern Canada. This was like 1984. That's too expensive to do long distance call. It was like $50 or something, crazy. So I waited until I got back to the U.S., went to my home near Seattle, and it was Tuesday, and I'd met her on Thursday. The following Tuesday, I call up, and a woman, old lady voice answers, and it's Mrs. Hieronymus. And I said, my name's Dean Howell. I'm supposed to call Galen Hieronymus. And she barely covers the receiver. She goes, Galen, will you answer? Dean Howell's finally called. And I go, what?
Whoa.
So I'm hanging on the phone, and then someone picks up on the other line. And he goes, you can hang up now. You remember that?
Yeah. I do remember that.
And I said, are you Dr. Hieronymus? Yeah. Are you Dean Howell? Yeah. He says, well, why'd you wait so long to call? I said, I just got back to the U.S. yesterday. He said, you could have called from Canada. I said, well, how did you know about me? He said, it was decided years ago. Are you coming down? And I said, what was decided years ago? He said, are you coming down? Yeah. Well, okay, well, tell me when your flight's coming in. And he hangs up.
Wow.
And so I start making arrangements to go down there, and then I get hypnotized.
What a trip.
And then I go down another time and it happens again. And so after that, I was doing radionics.
Wow.
But I don't know who decided years ago.
Yeah, that's wild. Another funny part about that story is in general, I think with hypnosis, you're supposed to ask the person's permission, right? He just like threw it on you. I guess his intent was benevolent, so it all worked out. But yeah, it's funny.
Yeah, there's a lot of weird things going on in the world, you know.
Yeah, there are,
and I certainly don't understand them all.
yeah. Who's your third?
The third would be James D'Adamo.
Oh, who's that?
He was the guy that came up with blood type diets.
Oh, really?
And the blood type diets, they're okay. But that was his big idea. And his son, Peter D'Adamo, had the bestseller, Eat Right for Your Type. And Peter was my best friend in medical school.
Oh, really?
That's how I ended up meeting his dad. But I spent a couple of weeks with his dad, spending each day seeing him dealing with his patients. And he would do iridology and blood type diet and tell them what was wrong. And he wouldn't let them tell him any of their complaints until he had already designed their whole protocol. So it really impressed them, you know. Yeah. But he was all about working with all these super rich people and running a good business. And I learned a lot from him.
What's your take on eating for your blood type in general? Do you think there's any validity to that?
Well, what Peter says is that 80% of the people feel better if they try that.
Mm-hmm.
And I think that that's better than eating a standard American diet. But truly, what I believe is that agriculture is a 15,000-year-old experiment, that it's failed, that the more that we live on hunter and gatherer style diets, the healthier we are, and that's all I'll do.
Yeah.
And so I don't care what James D'Adamo used to think. I'm not going to start eating carbs and stuff. And I'm going to eat a lot more protein than he ever said I should eat.
Right.
Because he always thought 4 ounces once or twice a day, that's plenty of meat.
Wow.
You know? And I went, no way, dude.
Oh, yeah.
Especially when I'm hungry for meat and I'm growing new tissue, man.
Yeah.
Some days I have to eat over a pound of meat, you know?
Yeah. I always say, and it's probably annoying to people because I say it so often, but I just don't have the discipline to do it. But I really think if I just ate meat and was just basically a carnivore diet, that's as good as I could feel. Like when I eat a lot of meat, that's the best.
Well, see, that's what we do. We do that stuff.
But it's a lot of work, you know. I just don't like sitting there and chewing on meat all day. So I eat, you know, I kind of cheat just to eat things that are more convenient at times.
But if you do that and are baked goods,
oh, well, that I can do.
Man, is it cool. And see, you can also get pasta and stuff that's carbohydrate free. So you can have cheese sauce and you can have baked goods and you can have meats.
You guys got to get this.
That's all I do.
You got to get this thing up and running and give me the link and I'll put it in the show notes for people.
Absolutely.
In closing, speaking of links, where can people find websites, social media, anything you want to send people to?
Okay. Yeah. So drdeanhowell.com, drdeanhowell.com. And really that'll link to all the other sites if you just go there. It's easy enough because it'll link to the Church of Divine Structure and the Essence of Life. And actually it'll even link to the Hillside Restaurant.
Oh, cool.
The hillside.biz. And that's where the stuff's being baked, but we're going to sell it through the church because we haven't got all the USDA stuff arranged yet. So,
right. Oh, I know what I want to ask you. Do you have any apprentices out there that are doing your work according to your protocol in the event that someone couldn't get to, you know, areas you service? There
are a number of people that are still doing the NCR protocols, and that would be the techniques up through, you know, about 2010. And one of those is my son, Derek, who's in Orange County. He's hard to get in with. But also there's Hillary Lampers in Montana and Deanna Simonson in Portland, Oregon. And there's Dean Odemark down in San Antonio. And they're doing the basic kinds of work. There are a few others whose names are blanking out right now. But there's only a few.
Is there a directory of the ones that you just mentioned anywhere on your site? Or
I don't think there is anymore.
Okay.
You type in Neurocranial Restructuring, and it'll start showing up. The other people.
We'll put them together, and we'll put links to their sites and stuff in the notes for people.
The work still is good. It's just it isn't as good as doing the energy work as well.
Yeah. I mean, what you guys do is a whole other thing. As I said, that was was just one part of it from my subjective experience.
Right. And so like the hip changes that you had would not have happened with NCR. Because that local intense connective tissue work, that's outside the normal,
right?
Aligning the spine and pelvis and feet.
Score for me. I went to the source. Yes. All right, man. Well, thank you so much for coming out. It's been so fun chatting with you. I'm really, really glad to know you, and I'm so grateful that I was able to, get the treatment from the man himself, and then share it with the world. So thank you so much.
Thanks for having me.